All right, well, before I share my screen, I'll introduce myself. My name is Veronica Coleman. I'm one of the assistant professors with the program. I'm also the director of admissions. I've been with UTSouthwestern now for a little over 5 years. Prior to joining the faculty at UTSouthwestern, I was full-time at Parkland in the Department of Plastic and Reconstructive Surgery. And prior to that, I was living in another state practicing plastic and reconstructive surgery there. So I'm a surgical PA. I've all surgery. I was trained in plastic and reconstructive surgery. It looks like there's some people in the waiting room. I don't know if I have to let them in since I'm now the host or not.
Yeah, if you could click on the waiting room and you can just click admit
Sure.
all.
I've admitted all of them, so
Perfect, thank you.
I will try to monitor the waiting room as well. Let's see. Let me see. Well, I was going to try to see if I could make you co-host that way, just in case more people come, you will have control. But yeah, it doesn't look like there is a co-host option on this version. Interesting. Okay, so anyway, like I was saying, I'm a surgical PA. Definitely love it. I think it's probably one of the, if not the best career choice out there. I have precepted students for well over 11 years or so. And like I said, joined the faculty at the program really after doing a lecture for them. They kind of just sucked me in and didn't let me go. So one of the really cool things about a lot of the faculty at UTSouthwestern is that they still practice clinically. So it's nice to have someone that's, you know, not just kind of sitting in an office teaching you, but you actually have real world practicing PAs. And all of our faculty are PAs or MDs. Our faculty chair is an MD, and of course our medical director is an MD. But all the rest of our faculty are all PAs. All right, so now I'm going to start sharing my screen. You guys can just give me a thumbs up to let me know if you can actually see it. Somebody, anybody?
Yes, we can see it.
You can see it, okay, great. There we go. All right, so a little bit about our program. I'm gonna move through this kind of quickly, so if you guys have questions, just let me know. We've been around for quite a while, since 1972. Quick, brief, real general definition of what a PA is. This is kind of basic. This is what you can get off of Google. I think big takeaways when you are talking to PAs and learning about PAs is understanding how our license works. So we take a national board exam at the end or the completion of our programming or our schooling. Average PA program is anywhere from 2 to 3 years. And at the completion of that program, you will sit for a board exam. Upon passing that exam, you are then boarded in what we call general medicine, giving you the authority to practice medicine in just about any field because you are boarded in general medicine and not a specific specialty. Now, when it comes to practicing medicine, you must be licensed. And so every state that you go to, you have to obtain a new license. You do not have to reboard or retest, but you do have to get a new license for that state. As a PA, you will reboard or renew your board certification every 10 years. Some basic roles, what PAs do. Once again, this is an old list, probably about as old as that photo on this slide. As PAs, you can practice just about any kind of medicine, and there's just about anything that you can do in the medical field. The only things that PAs do not do is we do not do surgeries on our own, and we do not deliver babies. Now, if a baby is coming, yes, you please catch the baby, please deliver the baby. You will receive training in that. But as a PA, if you work in the specialty of obstetrics and gynecology, your primary position or primary role will not be to deliver babies. Really important piece about our program is our mission statement. I always encourage students to familiarize yourself with the mission statement of any program that you say that you're interested in. This will really give you a good idea as to what that program is looking for. So when they are reviewing applications, when they are interviewing applicants, their mission statement should really drive it home and really direct you to what they want. Why would they choose one applicant over another? A lot of times you can gain those answers by familiarizing yourself with the mission statement. If you read their mission statement, and if you're lucky enough and they have a vision statement as well and goals, if you read those statements and they do not align with your innate morals and character and your values, then it is highly likely that that program is not for you, because you are not what they're looking for, and they're likely not going to be what you're looking for. National demographics. This really boils down to the fact that Texas is not doing a great job at bridging the gap between individuals who don't have access to healthcare and the individuals that can provide healthcare. So this is a really big driving force behind our mission statement, where we discuss developing primary care health providers. So when we are training our PA students, we are training PA students that want to go into primary health care. Texas is a huge state. We have a lot of individuals that live here, and we have a lot of individuals that do not have access to primary health care. Employment outlook has been positive for this profession for a very long time. Salaries are very comparable to what even some MDs make, considering which specialties you're looking at. The PA profession has consistently been ranked extremely high amongst other jobs in comparison, like nurse practitioner, CRNAs, a lot of the APP professions. PAs are consistently at the top of that list. Uh-oh. Sorry, guys. Can you see that? Probably so. Let me just make sure I don't lose my connection here.
I can only see the PowerPoint. I'm not seeing anything else.
Okay, you guys can only see the, okay, great. It's just a pop-up from our VPN. I just want to make sure it doesn't kick me out. Okay, great. So anyway, that's the big takeaway from this slide. Salaries for starting PAs in the state of Texas usually start in the low to mid six figures, and then progress from there depending upon how much experience you have and, once again, what specialty you're in. So down into kind of the nitty gritty about the program specifically. Program requirements. These are going to be kind of the most important slides here. Our deadline is September 1st, and that's for everything. So by September 1st, you must have your entire application complete and submitted. That includes GRE scores and letters of recommendation. We start a new cohort every year in May. The program itself is a little bit over 2 years. It's 30 months in length, and our minimum required GPA is 3.0 for both overall and science. This is a very busy slide and a very important slide. This is the gist of all of our big requirements in order to gain an interview with our program. So you must have all of your required courses, meaning your prerequisites. They must all be complete before or by the time you submit your application. So you cannot submit an application with prerequisites still in progress. They must be completed and the grade on the transcript by the time you submit that application. You must have a US or Canadian acquired bachelor's degree. We will not accept international bachelor's degrees, so they have to be from the United States or Canada. We do like to see volunteer service, hands-on patient care. We love to see all of those things, but they are not required. They are just strongly recommended. So we don't have a minimum amount of hours or anything like that. These are all considered application enhancements, but we will talk about what a competitive application would look like in just a second. You have to have a grade of C or higher, not C minus, but C. You must have taken the GRE unless you have a US or Canadian master's degree or higher. If you have a US or Canadian master's or higher, then you can waive the GRE. All prerequisites must be completed within 10 years of your date of matriculation. So 10 years from the year that you would matriculate into the program, not the year that you apply, but the year that you would matriculate. And then fairly new, about 3 years ago, we started this new policy. But if we have interviewed you twice and you have not been invited to join the program, we will no longer review your application. These are the prerequisites right here, and all of this can be found on our website as well. Big takeaways here is we will take a substitution of human A&P 1 and 2 with the labs in place of the full human anatomy with lab and full phys with lab. Every course that you see that has an asterisk by it must be a course that you take for science majors only. So we will not take human anatomy for nursing majors or human physiology for kinesiology majors or human physiology for pre-vet. We will only take those courses listed for science majors only. And then lastly, the human anatomy must be human. We will not take vertebrate anatomy in its place. We will take vertebrate physiology, but we will not take vertebrate anatomy because you are going to school to learn how to provide care for humans. That's what PAs do. We don't provide care for animals or vertebrates. So, but physiology, a liver is a liver is a liver. It has the same function, whether it's in a frog or a dog or a human. So hopefully that makes sense. Once again, a reminder, deadline September 1st for everything. Considerations. So these are the things that we're looking for. When my faculty sit down and we start reviewing applications, which usually happens right after CASPA opens in April every year, we are looking at quality and quantity of academic preparedness. What that basically means is we're looking at the number of BCPs or biologies, chemistries, and physics that you have. Those science courses really show us how prepared you are for that first semester of PA school, which is extremely rigorous and very heavily science-based courses. The students are actually not even in the PA school the first semester. They spend the majority of their time over at the medical school doing these science-based courses. We do look at healthcare experience. Once again, not required, but a competitive application will have 200 hours or more. A competitive application will have 50 semester hours of BCPs or more. We like to see awards, honors, service, and leadership. Once again, not required, but definitely makes you a more competitive applicant. The reason why we like to see this for our applicants is because we then expect this out of our students and out of our alum. We expect them to go out there and become leaders in their field of specialty. We expect them to at some point come back and teach our students and lecture our students. We expect them to come back and hopefully offer to be preceptors. So if you accept those types of individuals in your program from the beginning, then it's not brand new to them when they're in their second semester of PA school and you're asking them to go out and do presentations at the local high school about what a PA is, or to go and teach the middle school kids how to suture on bananas. And, you know, they know how to balance school and all of these other activities as long as you're accepting those kind of people in the program. 3 letters of reference is what's required. We ask that you really be mindful and thoughtful about who you ask to write your letters of reference, because remember, you won't be able to see these. They will submit these without you seeing them. And the individual submitting your reference will also have to fill out a questionnaire about how well they know you and what kind of person you are. How do you respond to criticism? They'll have to comment on your level of self-awareness. Do you handle conflict well? All of those kinds of things. And so you want to make sure that you're asking people that really truly know you to write these letters of reference, and not just someone that you think might be an influential individual and might make the person on the other end reading that letter say, oh, wow, she knows Mayor Johnson. You know, we really would rather see a letter from someone that really knows the kind of person that you are. Your personal statement or essay, you want to be very insightful and you want to be very mature in that essay. Please don't buy an essay off of Line. People used to be able to get away with that stuff back in the day, not anymore. We're finding more and more and more individuals that are getting flagged and caught by CASPA because they're falling into this bad practice. So please write your own personal statement. You know, take time to think about it. Look at your application. Any areas that may be red flags or areas of concern, this is your chance to address it in your personal statement. If you have an area where maybe your grades weren't that strong on your transcript, or if you took a gap year, or if there really truly is something in your life that happened that really led you to this career, then those are the things we want to hear. We don't want you to spend 500 characters giving us the definition of what a PA is. Remember that everyone that's reading your essay is a PA or has worked very closely with PAs. And so we already know those things. We want to know more about you. And then, of course, most competitive applications will be invited for interview. This is kind of a rundown of what I've already said. In terms of GPA, our minimum required, remember, is a 3.0, but a competitive would be 3.25 or higher. And then everything else that I covered here. So what are we looking for? These are the things listed here. These are those non-cognitive attributes that we are looking for in applicants, the things that you really can't teach. So these are the things that we're looking for you to walk in off of the street with. And it may seem weird, but we actually can interview individuals and see the people that just have no sense of professionalism, or they're just completely immature. They're just not ready. No life experiences or no commitment. So these, once again, are all listed on our website, but definitely the things that we are honing in on when we're looking at applications, and absolutely when we are doing interviews. The admissions process is basically rolling. The earlier you get your application in, the better. So a quick breakdown of what our current cohorts look like. Our class of 2022, these are our first years. We received over 1,800 verified applications. We did 162 interviews. We enrolled 60 students. Every cohort is 60 students in size, 46 females, 14 males, and 2 non-Texas residents. This is an average, kind of a breakdown of what they look like in terms of cognitive attributes other than their age. So their average science GPA, you can see there's a range from 3 to 4. So we don't just say that we take a minimum of 3 and then never accept anybody with a 3.0. We have a lot of students that were admitted that just met that minimum. And then we have some that are strange and they just made a 4.0 all the way through college. I didn't even know that was possible, but there are people out there that do it. And so we have some of those individuals as well. And then you can see the average, their average verbal and quantitative GRE score. Class of 2021, our second years, close to about the same amount of verified applications. Everything else pretty much the same. PA school is very heavy female dominated. So for the males out there, if there are any on this call, if you like women, it's a great place to be. If you don't, it might be a little challenging because there's usually a lot of them. They really do kind of dominate this profession at this point in time, which is interesting because early on it was males who dominated the PA profession, seeing as though it was grown out of the military. And then we have 1 non-Texas resident. Here's their averages here. And then our third years who are getting ready to graduate. A little bit over 1,600 applications their year. We did 162 interviews, still a whole bunch of females, 13 males, and 5 non-Texas residents. And here are their averages. Quick note about the residency information. So because we are a UT system program, so we are a Texas program, a state-funded program, we do have to abide by certain measures that are instituted by the state. One of those measures is they dictate the amount of out-of-staters that we can have in our program. So basically what the state law says is that we can only admit up to 10% of our total enrollment from out of the state of Texas. So if you do the math, that basically comes down to about 18 students across all 3 cohorts. And according to what you saw, I think we might be at 8. So, you know, if you are an out-of-stater, and I don't know how many of you all are from Texas going to school in Oklahoma or what the case may be, but I do just want to be very transparent about that. This is a beautiful picture of our 2021ers. Unfortunately, this was their white coat ceremony, and we do not have a picture like this for our 2022ers, of course, thanks to COVID. So their white coat was virtual, and I'm gonna have to find a picture of them all in their squares, but right now, this is the last class to take the picture on the stairwell. Student nutrition, this is definitely something you want to look into when you start looking at programs and really get on the circuit and start looking at different PA schools, is you want to look at their attrition rate. You want to find a program that's not out there trying to weed out students. We are not a weeding out program. You know, we tell our students we don't encourage competition. We don't encourage sabotage. You guys start as 60 students, and the goal is that you all graduate together as 60. But we do have students that decelerate. We do have students that withdraw. A very small percentage of them will decelerate or withdraw because of academic reasons. The majority of them, it is because of medical reasons or personal family issues. This is the cost. Texas residents versus non-Texas residents, and additional fees listed here. And then we are a BYOD campus, so you do have to bring your own device. You must have a laptop in order to attend PA school at UTSouthwestern. We do provide one of our students, we provide one white coat for them. That's the one we buy for them during their white coat ceremony, and then they have to purchase a second one on their own. And this is kind of the breakdown total throughout the entire course of the program. We are one of the few programs recently that received a national federal HRSA grant for $3.2 million. And that grant is specifically to increase the number of disadvantaged students enrolled in PA school. So we, as of a couple months ago, will be dispersing $3.2 million over the next 6 years to students enrolled in our program that come from disadvantaged backgrounds. And that can be economically disadvantaged, environmentally disadvantaged, or educationally disadvantaged, which first gen would qualify as educationally disadvantaged. The bright side is that it costs money to go to PA school, but you make money when you graduate. The job prospects are amazing out there right now, even during the times of COVID. So, all right, quickly into what the program actually looks like. So the students start in May, they start in the summer, they take 13 semester hours. You can see the breakdown of what courses they're taking listed here. Like I mentioned, all of these courses are taken at the medical school, except for the very last one, PPI 1, Professional Practice Issues 1. That's actually taught in the PA school by all the faculty. We each teach a specific part of it. And PPI 1 is really designed to introduce these students into what being a PA is about, medical ethics and law, professionalism, our state organizations, our national organizations, educational organizations, and so on. Fall semester, this is really when they get into the meat and potatoes of PA school. Now they start learning real medicine and what it's all about. So you'll see the courses listed here that have the number 1 beside them: clinical medicine, integration skills, patient eval, and pharmacology. These courses are part of what we call integrated blocks of instruction, meaning that when they are in clinical medicine, where they're learning the pathophysiology behind disease processes that affect all the different systems in the body, everything from neuro, from the brain, to cardiac, the heart, GI, so on and so forth, every other portion of those other courses listed that have the 1 by them will correlate to what they are learning in clinical medicine. So if they are in the cardiology block in clinical medicine, then in integration skills 1, they're going to be learning how to interview a patient that comes in with a cardiac complaint like chest pain. They're going to learn how to write a SOAP note for a patient that has a cardiac complaint. In patient eval, they're going to learn how to do the cardiac exam. And in pharmacology, they're going to learn all about the cardiac drugs. So that's what we mean by integrated blocks of instruction. And then pathology is another course taught at the medical school. And then professional development is a really cool class they get to take. It's an interprofessional course with the medical students, the PT students, clinical nutrition, P&O, rehab counseling, the grad school, nursing students from TWU, and Texas Tech pharmacy students. And so they do a lot of different sessions where they basically learn about the team approach to patient care. Spring semester looks very similar. All those classes that had a 1 now have a 2, 16 hours total. We do add 2 new courses, CPPH and EBM. So clinical prevention, population health, and evidence-based medicine. Evidence-based medicine is the course that's really going to teach you about journal articles and why we practice medicine the way we do. As providers, we should all practice evidence-based medicine. So what does that mean? That's what you learn in evidence-based medicine as a course. You learn how to read research articles and research papers, and you learn about statistics and how that applies to certain drug therapies, or how you treat things or disease processes as a whole. CPPH is a really, really interesting course. This is where we start to teach students about access and problems with access to certain healthcare, and we talk to them about barriers to healthcare depending upon certain populations, and pull into a lot of cultural sensitivity, and really teach you how to treat the whole patient. You have to be able to treat the patient as a whole. You can write prescriptions all day long, but if they're $20 for a month's supply and this patient has to decide whether or not that $20 goes to feeding their children or buying this medication, then guess what? They're likely going to feed their children and not buy the medicine. And then we move on to summer 2. This is a fast-paced, rigorous semester. This is their last semester before they go on to clinicals. So clinical medicine is a little different. In this course now, they've learned all of the body systems from head to toe. And at this point, they are learning how to apply all of that knowledge to specific patient populations. So pediatrics is part of Clin Med 3. OB-GYN, women's health, is part of Clin Med 3. And then surgery emergency medicine is part of Clin Med 3. Clinical skills, they learn about everything from intubations to drawing blood to reading x-rays to performing ACLS and BLS, suturing, casting, splinting, all of those kind of hands-on things that they consider fun. Patient eval 3 is when they actually start seeing patients in the hospital, or OSCE patients or simulated patients. Just a second, I need to admit someone. Alrighty. And then psychiatry. So highlights about the first 15 months of the program are listed here. The students do have access to a full cadaver lab when they do human anatomy, except for this most recent cohort, the 2022ers, who actually had to do virtual anatomy, of course, in light of the COVID pandemic. Clinical rotations, we're going to just kind of breeze through the core rotations. So there's an 8-week internal medicine rotation. It's done all inpatient at a variety of locations across the DFW area. Emergency medicine is 4 weeks at a bunch of different ERs all over the Dallas-Fort Worth area. And they will do anywhere from 10 to 12-hour shifts, depending upon the location that they're assigned to. Surgery is 4 weeks, very unique. Our students actually do their surgery rotation alongside our medical students during the medical student surgery clerkship. So it's really nice. They actually rotate together on assigned teams. They participate in surgical cases together, and then also run clinics together. Peds is 4 weeks. It's all outpatient, variety of private practices all over DFW, Waco, and Temple, Texas. Women's health is 4 weeks. It's a 2 and 2. 2 weeks of obstetrics and then 2 weeks of gynecology. Family medicine, 8 weeks, multiple private practices. It's all outpatient as well. Psych is 4 weeks. They will do a 2 and 2 depending upon which facility they go to. We do have an assigned site at the Dallas County Jail. And so the students that go there, of course, they do their entire 4 weeks at the Dallas County Jail. Infectious disease is a unique rotation to the UT Southwestern program. It's not considered a core rotation across PA programs as a whole. We actually started this rotation about 10 years ago, and actually it's been longer than 10 years now. I think it's 13 years. And what they noticed is that when they implemented the infectious disease rotation, the board scores went up tremendously. So the students having 4 full weeks on infectious disease really increased their knowledge of the antibiogram and how to treat disease processes with antibiotics, antivirals, retrovirals, so on and so forth. And then the primary care preceptorship. This is also unique to our program. This is an 8-week-long experience in some area that is directly related to primary care. The reason that we implemented the PCP, as we call it, was really to kind of bring our students back home, to really refocus them back on the mission of this program, which is to produce primary care providers. And so after they've done all those different specialty core rotations, we bring them back home and remind them that the whole goal is to increase our representation in primary care. So that's family medicine, internal medicine, outpatient, pediatrics, general women's health, and also geriatrics and rural medicine. And then all students will get a clinical elective. And that's a 4-week-long rotation, really in any field of the student's choosing. And luckily, we have such great relationships with major institutions in the DFW area that we're able to offer our students well over 25 different specialties to choose from. And they can also choose to do international rotations if they'd like. We've had students go to Guatemala, to Africa, to Peru. But of course, none of that is happening right now. Everybody's staying right here. So highlights of the last 15 months, all listed here. Just want to point out the fact that we do an in-house PANTS review course for our students, their final week right before they leave, to get them further prepared for taking their boards. And then we also do an on-site job fair for all of our students and any alums as well. We do invite our alums back for the job fair. So we have very close personal relationships and affiliations with 2 of the largest institutions in Dallas, Parkland Hospital, which is considered the county hospital. It is also a level 1 trauma center with an internationally recognized burn center. Tons of beds, huge facility. It's where I used to work. That's how it looks now. Didn't look like that when I worked there, but it is beautiful. And they even have a garden that grows rosemary. And then Clements University Hospital, which is right across the yard from the PA school itself. And a little bit of bragging, we were recently ranked number 7 nationally out of 170 PA programs. We're very, very, very excited about that because we were sitting at number 15 for a long time. So very happy about that. And then biggest bragging right was the first time PANTS pass rate greater than 10 years. And you can see all the years there. That basically just means that every PA student that graduated from the program passed their PANTS on the very first attempt. Only 4 programs in the nation can say that they have a running list like this. So we're very, very proud of that. Our program accreditation, we've been accredited since we basically started 1973, and we have had no adverse accreditation actions ever against our accreditation. We've never been on probation, never been close to being on probation. So definitely make sure you guys remember to look into the accreditation of every program that you're interested in, because you don't want to end up at a program that loses their accreditation, because then it will be virtually impossible for you to get a license if you graduate from a program that is not accredited. So just remember that. If the program is on probation, that's okay. You just want to find out what their plan is. What are they doing to ensure that they come off of probation and don't, in fact, get suspended? Application service, CASPA, that's the only service that we utilize. So I definitely recommend you become familiar with it when you get ready to apply. This was a study that was done by the Education Association of PAs that basically found that if you apply to only one PA program, you have a 25% chance, and it's actually less than a 25% chance of getting accepted into that one program. But if you apply to 12 programs, your likelihood of getting accepted goes up to almost 50%. Now, there was no additional advantage found for applying to more than 12. But we say all of this really to just encourage you all to cast a wide net. You want to look at multiple programs. Don't try to suicide into just one program. If you look at the numbers for UT Southwestern, it really is about a 4% chance of getting in if you only apply to UT Southwestern. So look around at all the different programs that you like. Look at some cities that maybe you've always wanted to live in, some places that you think it might be great to go to school in. Cast a wide net. What we recommend is that you apply to 5 programs. Consider it a $400 investment into your future. It's definitely worth it. So this is our website. If you are invited for an interview or if you just might be interested in general, please visit our website. There's tons and tons of information on there, including this presentation that you would have direct access to, and it would definitely help answer any questions you might have about UT Southwestern. Other sites we recommend, we count scribing as hands-on patient contact. So we always recommend that individuals look into scribing if it's something that you're, you think you can actually do. And if you're looking for those PCE hours, these are some different companies that our students have used. And then, of course, always knowing your national organization, which is AAPA, your state, which is TAPA, and then the Educational Association, which is PAEA. If you're ever curious about a program's attrition rate or whether or not their accreditation is in good standing, you can get all that information from PAEA. Full disclosure, I'm sure you guys have heard this tons of times, especially if you are actively applying to PA school. PA school is rigorous and it's fast-paced. We implore all of our students and all of our applicants to please make sure that you really get everything in order before starting PA school, because there really is not a work-life balance in the sense that you can go to school and then go pick the kids up after school, or go to school and then go home and make dinner for everyone, or go to school and be in bed by 9. It's just not a realistic idea to have. It is very challenging, and most say that it's more challenging than anything they've ever done in their educational career, even if they have been to grad school. So your time is truly not your own when you're in PA school, regardless of what program you go to. Our students have a course on Thursday nights that runs until 8:30 at night. So you can imagine if you're the only person that's responsible for picking the kids up or making dinner, or if you have a partner or a spouse that expects you to be home by 9 every night and you guys have dinner and then go to bed together at the same time, it's likely not going to work out. So it ends up causing a lot of undue and unnecessary stress on the students, because their individuals that they thought were going to be their support group didn't realize how great of a commitment it was going to be. Our faculty, really quickly, I will show you their pictures. This is everybody. I'm not going to name them all. Individuals I do want to point out, though, is Dr. Temple House Stampley, right here where my cursor is. She is our program chair and director. She's also an internal medicine physician who did her residency at UT Southwestern. Dr. Orcutt is an alum of the UT Southwestern PA program and the associate program chair. Dr. Laurette Deckett is our medical director. And then 2 other individuals I love to point out. Dr. Carolyn Bradley Guidry is another alum of the PA program and currently the Director of Diversity and Inclusion. And then Professor Bethany Grubb is another alum of the Southwestern program and a graduate of the Dermatology Fellowship at Southwestern. And she is one of our newest faculty members. So I think it just says a lot when you are at a program where the students graduate, go out into the real world, practice medicine, and then come back and actually teach at that program. So I always like to point them out. And then, of course, our staff, they are the individuals that really, truly keep us running. They're kind of the machine behind everything that you see. And they're all here. If you've ever called our program before, this is Miss Beverly Curtis. She is the very sweet voice that you hear that answers the phone whenever you call. And then Miss Rita Billups is our senior program director. And then Ms. Heather Salinas is our assistant program director. And then Ms. Isela Perez is kind of my right hand. She helps run everything at Missions. And she's our resident CASPA expert. So common questions that I've encountered since COVID hit. What's happening with the program now? What are we doing? So currently the class of 2020 was delayed. They are delayed in graduation. Normally everyone graduates in December. But due to the pandemic and the decreased access in PPE or personal protective equipment, we had to pull all of our students off of rotations for about 3 months, right at the height of the pandemic. And I like to be very clear about that. We didn't pull them off of rotations because we were in a pandemic. I mean, you're going to school to be a healthcare provider. There's always a virus out there. That's why we practice universal precautions. So if COVID hit and all of a sudden you start questioning whether or not, you know, you want to go on rotations, then this may not be, you know, the field for you, because there's always going to be something out there. We pulled our students because there wasn't enough access to gloves and masks and gowns. And so the providers at those locations needed those, and we couldn't have students there or learners there taking from that. So they will be graduating at the end of February. They're delayed. They're back on rotations now, but they will not graduate until February. The 2021ers were just troopers. They hung in there with us. They learned how to use Zoom while we were learning how to use Zoom. They went totally virtual, and they were just fighters, and they were phenomenal. And now they're out on rotations, doing extremely well, set to graduate on time. And then the incoming, now already starting class of 2022, they have been all virtual since day one. So they are doing well. They all survived virtual anatomy, but they are still trying to get to know each other, because this is the first class we've ever had that has not had a chance to all be together in person. So they're still learning one another. Will there be a 2023? Yes, we are actively interviewing now. We received over 2,000 applications verified. We have done 2 sets of interviews so far. We've interviewed 60 applicants. We are planning to do 6 total sets of interviews, and a little bit over 160 applicants, 170, excuse me, applicants that we will interview. Did we adjust any requirements on prereqs or anything else? No, we didn't. We kept them the exact same. The only thing we did change is we did accept and do accept the at-home GRE. We will not accept grades of pass or fail or unsatisfactory or satisfactory for any prerequisites. We do know a lot of programs went to that method, and that's fine. We'll accept that on any other courses, but not prerequisites. Online labs and courses being taught in a virtual setting, we've always accepted online labs, so that's not anything new for us. Inability to obtain PCE and HCE, remember, we don't require patient care or healthcare experience. They're just considered application enhancers. So those people that were already doing it before COVID hit, they have hours. Those people that waited until the last minute to try to collect them, they don't have any, because a lot of sites are not allowing people to come in and do that external learning or extra learning. And then deadline adjustments, no, we're still, the deadline was the same, which is September 1st. All right, I made it through that whole presentation. Do you guys have any questions?
I have one. So at the beginning, you mentioned that in obstetrics, PAs aren't focusing on catching the baby. So can you elaborate on what they do focus on?
Yeah, absolutely. So most PAs that work in OB-GYN are really more focused on the GYN side of things. So in terms of the obstetric side, yes, they're going to do your well baby maternal checks. So you're coming in, listening to heart rhythms, listening to the baby. They're going to be measuring out your fundal height. They do all of those things. They do everything that needs to be done prior to the baby being delivered. And then they're very heavily utilized on the GYN side. So well woman exams, your annual PAP, whether it's rectal exams or STD screenings, any of those things, yes, the PAs are doing all of that and then some. They are just not the ones that are in the birthing room delivering the baby. Now they scrub in on surgeries, GYN surgeries, they're there. If you happen to be with a provider that works with at-risk pregnancies, so the majority of those pregnancies are C-sections, so then yes, the PAs are scrubbing in on those cases all the time. It's just the general delivery of a baby coming out of the vaginal vaults and being caught. You're not going to see the PA down there doing that. Anything else? Nothing at all? No hot burning concerns?
I have a question on like you as a PA. What made you pick like surgery and plastic surgery and all that stuff? What drew you towards that field?
I have always been an individual that I love working with my hands. In PA school, I realized very early that I could suture better than most. And I thought I wanted to do derm because I thought the lifestyle was nice. It didn't seem like they had a whole lot of emergencies, and it didn't seem like they were on call a whole lot. But there's just something about plastics. And for me, it's the reconstructive side. I know a lot of people hear plastic surgery and they think of the glamour and Dr. 90210 and all that crap on TV. But for me, it was more the reconstructive side. Something about being with a patient, soon after being diagnosed with breast cancer, and they come to see you because now they know that they're going to have their breast removed, and they're trying to find out what their options are and what you can do to make them feel like a whole woman, because now they're worried, my hair's going to fall out, you're going to take my breast, and I'm not going to feel like a woman. And so going through that process with them of reconstructing their breast after it basically being ravaged by cancer, or even something like an individual who's had a terrible burn. I think about some of the most memorable cases I've done, whether they be child abuse cases or cancer cases, and it's the reconstructive side. Those are some of the most grateful and inspiring patients I've ever encountered. And so that's what I loved about it. It's funny because now I'm working more with surgical oncology, and I always said I would never work with cancer patients. And they are, to this very day, my favorite, because they are some of the most grateful individuals. So I do not do Botox. I know how. I've been certified, but I'm not that kind of provider. I don't do Botox. I've done a ton of breast augmentations, yes, tummy tucks, Brazilian butt lifts. I've done enough of those for a lifetime. I don't do those anymore.
Could you tell me, like in your personal opinion, what the top specialties for PAs are?
Specialties. So I would say from our program, our graduates, the majority of our graduates that don't go into primary care, of course, remembering that's our focus. The majority of the graduates I see go into emergency medicine, orthopedics, derm, and lately urology and interventional radiology. Those would be the top, I would say. And mainly because it looks like with the younger applicants that we get, a lot of our millennials are coming out of PA school and really getting interested in doing residencies and fellowships. And so we're seeing more and more PA students graduate PA school and go into specialty fellowships or residencies. And those are the top ones that I've seen.
Would you say that most people like start at primary care and then after that they'll break off and specialize into something else?
Yes, yeah, and we usually recommend that just because it's kind of difficult to jump right into a specialty with no real specialty training. Once again, I think that's why a lot of our younger grads tend to go into a fellowship so they get that extra year or that extra year and a half, depending upon the length of the program. And then they do that specialty. But we, of course, highly recommend primary care. And remembering, of course, primary care encompasses a lot of things. You know, it's not just family medicine or just internal medicine, outpatient. It's general pediatrics, you know, it's general women's health. So it's really just treating the whole patient. I think you really need to know how to treat things like high blood pressure or diabetes or, you know, how to recognize a stroke or, you know, those kinds of things, you know, before you're kind of all focused on the bones, you know, and ortho only. You know, we constantly make jokes about some of our alums that have gone into ortho and we're like, you don't even own a real stethoscope anymore. Like, do you even remember where the heart is or where the lungs are? And it's not that they're not, you know, fabulous in their specialty, but some of them never even truly honed in on those skills first, you know. I mean, I'm a surgical PA, but I've taken groups of students to Guatemala where I was treating diabetes and, you know, foot fungus and, you know, pulling a fish spear bone out of some kid's abdomen. So I think it's being able to do all of that and feeling comfortable in that first.
Can you tell us, just give us like a little overview about general health? Like, what are you going to be doing most often?
So it depends. It depends on which part of primary care you go into. You know, if you are doing family medicine, which I think is probably one of the most phenomenal because you see just about everything. And that's what the students always say they love about it. Like, you can see a newborn baby, or you can see geriatrics, you know, someone who's celebrating their 99th birthday. You know, you may see teenagers coming in for STIs or, you know, colds and the flu and, you know, those kinds of things. You can do CDL physicals, so a full head to toe physical, which is always great because you've got to do a lot of those to remember all the pieces of the physical exam and how to do that. But then you may also see someone that just comes in because their stomach aches, you know. For peds, once again, it's really the same thing. It's a plethora of things. It can be anything from child abuse to sexual abuse to a 14-year-old that's pregnant or a 12-year-old with an STI or just a mom coming in to get her kids shots, to get their immunizations. Of course, coughs, colds, and the flu, aches and pains, all of those things. And then, of course, women's health. Once again, same thing, but just women. So I don't think it's ever just one thing. It just depends on what they do at your practice. We even have some students that have gone to work at practices where they practice Eastern medicine or holistic care. And so they end up learning about herbals and all these other different things and how they treat this, that, and the other. And they come back and tell us about red yeast rice and how it helps with, you know, hypertension and aches and pains. And, you know, so there's so much out there and so many providers now that are into this essential oils. And so they will end up even learning about those kinds of things. It, like I said, once again, when it comes to primary care, it is the holistic approach to patients. So treating the whole patient, you've got to know, you have to know how to take care of everything from a headache to a diabetic foot ulcer. Which clinical rotation do the majority of your students seem to enjoy the most? Ooh, that's a good question. I would say it's a good mix between peds, emergency medicine, family medicine, ID, and surgery. I mean, because you're going to have some students that are just they love kids, and so they think everything about peds is great. You'll have some students that are like me, who I just was not feeling it. I don't do sick kids, and I sure as heck don't do sick kids and their parents. And so it wasn't for me. I will say, I think as you go through clinical rotations, the best part is students really, if nothing else, they figure out what they don't want to do. Like some of them will say, I thought I wanted to do OB-GYN, but whew, after doing 4 weeks of pap smears, I'm good. I'm fine. If I never see another one again, I'm good with it. So you figure out what you like and what you don't like. But they tend to enjoy emergency medicine just because of so much that comes in. Do you recommend doing CNA? So that's a good question. It depends. When you're trying to decide between hands-on patient contact, which we call PCE, versus HCE, which is healthcare experience or healthcare exposure, you need to look at what your duties are. So we don't just look at the title of CNA, because that could be anything. I've seen CNAs apply that file charts and room patients and, take the patient to go get an x-ray. And I've seen CNAs that take blood pressures and take blood sugars and weigh the patients and do patient education. So you really want to look at what your role is. If you are doing things that an actual PA would do, like we do patient education all the time. We educate patients about their medications. Sometimes we take vitals. Sometimes we collect blood sugars and have to, stick their fingers and all that. Those items, those duties count as PCE, or hands-on patient contact. If you are transporting patients, bathing patients, helping them brush their hair, brush their teeth, filing charts, bringing them from the waiting room back to the room where they're going to be seen in, rooming patients, that's all HCE. That's healthcare experience or healthcare exposure. But that's not hands-on patient contact, because we don't do that. I don't room my own patients. I don't transfer them. I don't push them out in their wheelchairs. I don't bathe them. I don't do any of those things. So that would not be considered PCE. We do count scribing, though, as patient care contact, and that varies from program to program. Any other questions?
So kind of thinking back before you entered PA school, what is something that you wish you had known before you started?
Two things. First thing I wish I would have known was that the money doesn't matter, and not to worry about the money. I was a non-traditional student, so I had been out of college for a while. I had been working in not a different field, but I wasn't a PA. And so my big thing was I didn't want to be a burden on anyone. I didn't want to take out more student loans. And I really put off going to PA school for a while because I was worried about the money. And I wish I would have known then that there were so many programs, so many federal programs and state programs, so many scholarships, so many things out there just for PAs that are willing to go into certain specialties, or PAs that want to work with the medically underserved. I mean, there is a program out there called National Health Service Corps. They will pay all of your student loans back, plus give you extra money for the amount of years that you work in a medically underserved community. And I knew that I wanted to work with the medically underserved, and I did that as soon as I graduated. But had I known about that program, I could have been reimbursed all of my tuition and gotten an extra check just for doing what I wanted to do anyway. I mean, those were the individuals I wanted to work with. So I wish I would have known that. The other thing that I wish I would have known was, I think it would have been nice to know that I wasn't alone in this. So they've done so many studies now, and programs are becoming more and more enlightened about what students actually go through in PA school. I mean, I went to PA school back when applications were still on paper and you mailed them in, and if you got the big envelope, you got in, and if you got the little thin envelope, it was going to be a sad day in your house. And so, you know, back then, we didn't know that it had a title, but now they call it imposter phenomenon. And so for a very long time, when I was in PA school, I felt like I didn't belong. I literally at times would walk around waiting for them to come and tell me, oh, you know what, Veronica, we made a mistake. You're not supposed to be here. And so I constantly compared myself to my classmates. I constantly felt like I wasn't smart enough to be there. And kind of, you know, I mean, it seems kind of crazy, but that's exactly how I felt. And partly why I went into education and wanted to precept students, because there was no one else in my class that looked like me. I had no instructors that looked like me, none of my professors, and none of my preceptors. And so it was difficult not to see any representation. And so I think it would have been nice to know that I wasn't the only one. I wasn't alone. There were others. I just didn't see them where I was. And so now programs are doing a whole lot better with diversity and inclusion and belonging, and making sure that, you know, people that come in and experience imposter syndrome or imposter phenomenon, you know, that they have resources to help. Looks like there's some questions. How difficult will you say it is for a freshly graduated bachelor's student to get into the program? It's not difficult, honestly. I think with so many schools now having these pre-PA programs like you guys, we're seeing more and more, we call them babies because they come straight out of college. I mean, we have a few students now that like graduated on a Sunday and started PA school on a Monday, which is just craziness to me. But it's because they're in these kind of groups where they are prepping them and getting them prepared before their 4 years is up. So they have all their prereqs, they have PCEs, HCEs, they shadow somebody, they know how to write an essay. I mean, they've covered all the bases. And so we're seeing a lot more of these babies that come in. And because they've done all these different things in these organizations, you know, volunteering, they were at the free clinic helping, they did a coat drive, they gave a turkey away for Thanksgiving, all this different stuff. They actually come in with a lot of service. They have a lot of life experience, although they may be young in age. They're still very mature and self-aware. And so it's not as difficult as we once thought it was. I mean, they're coming in and they're balancing it, and you know, they're kicking butt. So maybe if you would have asked me that my first year in education, I probably would say, no, don't do it, take a gap year. But if you are properly prepared, then it shouldn't be difficult. It should be a cakewalk like it has been for the ones that we've admitted. What are your thoughts on volunteering hours? I expect to see it. Those are my thoughts. When I look at an application, I expect to see every section of that application on CASPA to have something in it. So if there's a spot for volunteer hours, I expect to see it. If there's a spot for service or community service, I expect to see it. If there's a spot for leadership, I expect to see it. If there's a spot for awards or scholarships, I expect to see it. How heavy does the GRE weigh on getting? So I will speak from my perspective, and I hope most of my faculty. For us, for me, it doesn't weigh very heavy at all. That's why we don't have a minimum score. So we require that you take it. Now, I will tell you that a competitive GRE score is 300 or higher. So it is nice to see 150 in each category with a 4.0 analytical. But do I invite students for interviews that don't have that? Yes, I do. But if I'm inviting them for an interview and they don't have that, and it's pretty below that 300 number, then I'm expecting to see a whole lot of other stuff. I'm expecting to see a lot of service, a job while they're in school, quite a few other things going on, some sports. You know, a lot of our athletes are some of the best students because they've balanced it all. You know, they've been division whatever sports, and they kept their grades up, you know, or maybe they have that 3.2, you know, but they were a competitive swimmer the whole time they were in school, or we get a lot of softball players with these females. And so, you know, one thing I love about them is they'll be the first ones to say, they just need to put their big girl panties on. And I'm like, exactly, because there is no whining in PA school. So we tend to get a lot of well-adjusted and flexible individuals that have played sports, because you got to be flexible in PA school. What makes an applicant stand out? All of those things that were on my PowerPoint that said what we're looking for, that's what makes them stand out. Someone that can write an essay, a personal statement that is mature and insightful. For me, the personal statement, that makes it or breaks it, because a lot of times these applications start to look the same. And because of these pre-PA programs. So everybody got all the same stuff. They all have everything that you're looking for on their application. So it's that personal statement that really makes or breaks it for us a lot of the times. The ones that write those personal statements with those big dramatic openings about, you know, the crash, the bang, the blood splattered on the wall, the pigs were screaming, the dying woman in the pit of mud. I mean, I'm not reading that. And I can be honest, I stop reading when I see those. That is somebody with no self-awareness. That's not what we're looking for. I'm not trying to find a literary masterpiece where you used every adjective and verb that you could find. I really just want to know what made you want to be a PA. That's all the prompt says. What made you want to be a PA, right? The motivating factors. I don't think it had anything to do with the blood squirting on the wall. And the one girl wrote about how they did surgery on her uncle on Thanksgiving on the dining room table. Does that sound like a good idea, first of all? And secondly, I mean, it doesn't make sense. You know, we've seen essays about riding horses through the field. That doesn't have anything to do with being a PA. And not everyone has a big bang, pow, wow moment. So, you know, everyone's not going to have this big dramatic opening. Some people just met a PA and they thought, this sounds kind of cool, and they started investigating it. Some people were accountants and said, this isn't what I want to do. I want to touch people. I want to change people's lives, you know? You know, some people, their moms were PAs, you know? So that's what makes you stand out, your level of insight, you know, your ability to explain anything in your application that might be a red flag to the person reading it. You know, just tell us your story. That's what we always say. Just tell us your story. Tell us who you are. Tell us what got you here. You know, if you had some stumbles in, you know, on the road to PA school, tell us what happened. And most importantly, please remember this. If you are a reapplicant or a re-interview, please don't send the same essay. Please take the time to write another one, or at least update it. Remember that wherever you apply, whether it's UTSouthwestern or somewhere else, they can go back and look to see if you applied before. A lot of them will have special design questions like we do that asks, you know, it asks the question, have you applied before and have you interviewed before? Because we want to know if you've applied before, it's highly likely that you've applied to other programs too, and yet and still you're back again. So that means you didn't get into any of those programs, and we know that you didn't get into ours. So the question is, well, what have you been doing for the past year? What have you done to make yourself more well prepared, or, you know, more competitive? Or did you need to maybe, you know, boost up your service? Or have you done some leadership? Or have you done this, that, or the other? So, you know, please don't send the same personal statement and essay and not address, you know, changes. We expect to see growth. We expect to see some change. A year is a long time. I mean, look at 2020. I'm ready for it to be over and it's still here. So a lot can happen in a year. Same thing with re-interviews. If you interviewed before, mention it. It's not a secret. It's nothing to be ashamed of. Just tell us what you've been doing, what you learned from it. Any other questions I can answer? Okay. Are many of you guys applying this cycle? Or have any of you all applied this cycle? Okay, one, okay. All right.
I did, and the president that couldn't be here today, Lauren, she applied. I think she might have applied there because she goes to Texas. Um,
Mm,
so she might have applied at your school.
awesome. Yeah, well, familiarize yourself. Those of you all who did apply and those that didn't, make sure that you familiarize yourself with the interview process when you get invited to interviews. It definitely helps with the stress and anxiety of just interviewing, period. So try to find out as much as you can about how they do their interviews. At UT Southwestern, we do what's called the MMI. We were the first PA program actually to utilize the MMI, and it's the multiple mini interview. It's a little bit different interviewing style, so it's not like the panel or the one-on-one where we say, you know, tell us where you see yourself in 5 years. It really is a more relaxed format, and it's designed to be able to gain access to what we call the non-cognitive attributes of the applicant. So it's a 7-minute interview with one faculty member, and you have 10 of those 7-minute interview stations. And each station is designed to really just gain access or enlightenment about a certain non-cognitive attribute. So a little bit different from a traditional interview.
Are you doing in-person interviews or are you doing Zoom?
Good question. So we are not, because of course we have a hospital and clinic and everything else on our grounds, we are not allowed to bring any outside applicants into the program. So everything is on good old handy dandy Zoom. I wish I would have invented it. But yeah, everything's on Zoom, including our meet and greets. They're all on Zoom.